The Asian American Health Initiative was founded in 2005 to combat a lot of the different health disparities facing Asian Americans in the county. And I mean, I've been working here since October, and it's really a fantastic initiative. And in Montgomery County, about 45% of Maryland's Asian Americans reside here in the county. And so this encompasses over 50 different ethnicities, and even within that there's a multitude of religions, cultures, attitudes, perceptions, behaviors. And so within all of that tremendous diversity, I think that there are, of course there's more benefits and challenges, but the challenges of it is how do you give the best care to every single one of those constituents, knowing how vast and how diverse they are. And I think that through the model that we use, which is just going directly to the community, asking the community, what are your needs, how can we help you, what do you need us to do for you, and to do it in a manner that is linguistically competent, culturally competent, and again, just it's whatever it is that needs to be done. Well, my recommendation is that people need to just go out in the community and see things for themselves. Montgomery County is so diverse, and you wouldn't know it if you just stayed in your box all day. I mean, you have to go to all the community centers, you have to go to all the places of worship and just really just see all the different people. And one thing that particularly plagues Asian Americans is the idea of the model myth minority, where a lot of people think that all Asian Americans have high socioeconomic wealth, are very well educated, are very healthy, and while that is true for some Asian Americans, that's definitely not something that can be used for all Asian Americans. And while we're on that point, not only are there those types of stereotypes, but there is also a bit of racism, there's judgment, and I mean, it's just natural that sometimes people do feel the need to express their superiority over others, which I mean is just a complete barrier to achieving health, which is the goal that every single person
started with the initiative last July 2008. And I am very happy to be part of it. I think that all my life I was dreaming of having a job like the one I have right now, so I can help people and I can give the very best of my ability and my potential. And I think that helping people is the best that can ever happen in my life. It is priceless. My recommendation will be, and also my advice is to incorporate in the community, because there are so many ways that we can do to help others. And like I said before, it is priceless, and I think it's great. It is rewarding to help other people.
I am now the manager of the Foreign Trained Health Professionals program. We work with foreign trained health professionals who live here in the area, have been trained in their own country, and want to go back to working what they love. First of all, it's very important in my life, because I found a place, as Jose said before, where I found my dream job. I am very happy to be in a place where I can fulfill my dream for justice, truth, and beauty in my life and share it with others. And I said that especially because of our recent opening of the program to other ethnicities. We help foreign trained professionals from Latin America and all over the world. We as immigrants share a common thing. We want to contribute to this community. We want to do the best we can. And I know that fulfilling the dream of 11 nurses who are now registered nurses working here in our healthcare system from our 25 participants is amazing. And not only amazing because of fulfilling their dream, but because of their contributions. When they started the program, they changed their salary 150%.
What do you think is going to be the greatest challenge in making this work in the county among Latino Americans?
Yes. The greatest challenge for all of us, immigrants and Americans, is to be open to learn about each other. We share a lot in common, we have a lot of differences, but we certainly have a lot of ground to work together. And unless we are open to that, we will not be successful. Partnerships are crucial, starting from our Latino Health Steering Committee for Montgomery County, who help us to advocate for the needs of our community. We may have great ideas of projects and things, but as long as we learn what the community needs and partner with those who can help us, those who are experts in the various fields we need help, it would be very difficult to be successful. So we need to be open to leverage resources and work with others and learn from each other.
I was born here. My mother is from Guyana, South America, and my father is from Sierra Leone, West Africa. I'm the program assistant with the African American Health Program, and actually it started as a health initiative in 1999. In 2003, it became the African American Health Program. Our mission is to eliminate health disparities and improve the number and quality years of life for African Americans in Montgomery County. We have 5 health areas that focus on infant mortality, cardiovascular disease, oral health, cancer, and diabetes. And it's very important for us to be in the community, to educate, and to make everyone aware of the health disparities that exist. And we have Robin Worsley, who's our certified diabetes educator.
I am the certified diabetes educator for the African American Health Program, and actually Montgomery County is the grant-funded actual program for Montgomery County, and we are contracted through Beta Associates, and our program does offer a lot of different health related community outreach services. Our diabetes classes, we actually have different sites up county and down county in Montgomery County, and also we have monthly dining clubs. We also have health promoters, and we also have interns that we also have in our program. And my part is that I do one-on-one sessions with diabetes, and our clientele is predominantly African Americans, and because we are the highest ranked actually African American population, our actual mission to eliminate all of the health disparities, diabetes is really rising, and we offer individualized training, diabetes education, nutrition, and also activity. So we try to have their medication and insulin regulated to better manage their diet. They're able to trust me as not only a health educator, but to help them to reach their diabetic target levels, which is checking and monitoring their blood sugars. And I've even had some of my clients who have never even checked their blood sugars until they actually finish taking one of the sessions.
And I have been fortunate enough to have the opportunity to be an intern at the African American Health Program. I'm from the University of Maryland, College Park, and having an internship with the African American Health Program helps satisfy my requirement for my public and community health. One of the mottos that I've seen is every child, every chance, and I really feel like the African American Health Program lives up to that area of expertise. It's an opportunity afforded to everyone, and it's meant to be all-inclusive so everyone can grow and learn and just actually live up to the mission of quality life for every African American. I would recommend that it's nothing like going out into the community and actually getting the answers for yourself. Like the African American Health Program offers screenings that are irreplaceable. So I feel as though going out is, for me, getting out of the classroom and being an intern and being immersed in the community is what people need to do. They need to take advantage of the health fair and the screenings and the opportunities that the program provides, because it's here to help everyone, and that's exactly what it does.
One Healthy Life offers the focus that each individual or participant is unique in their own unique way. And what we want to do is to make a difference in aiming at the African American minority population in Montgomery County. And the African American Health Program is doing that, and I'm proud to be a part.